Hello, and welcome again to this virtual symposium. My name is Erwin Alles, and I'm a lecturer with the WEISS Center at University College London. Today I will be talking about a new approach to optical ultrasound imaging, which enables video rate and freehand imaging. Traditionally, optical ultrasound imaging is performed using miniature imaging probes comprising two optical fibers. One fiber contains an optically absorbing coating that converts excitation light into broadband ultrasound via the photoacoustic effect, while the other fiber comprises a highly sensitive fibro structure to detect pulse echo ultrasound signals. Such fiber optic probes can be inexpensive, highly miniature, and immune to electromagnetic interference. So in the past, many of us have demonstrated that mechanically scanning such a probe can yield beautiful images. For instance, this image of an ex vivo sample of porcine aorta clearly shows the various layers of the vessel wall as well as a bifurcation. However, the mechanical motion required to acquire such images results in acquisition times of minutes for 2D and hours for 3D images, which severely limits the clinical applicability of such imaging probes. So to overcome this speed bottleneck, we have developed a different imaging setup where not two, but many optical fibers are used. Using scanning optics, excitation light is coupled sequentially into each of these fibers and thereby delivered to an ultrasound generating coating. In this manner, the source aperture can be rapidly synthesized, which results in a sustained imaging frame rate of 12 Hertz. So the use of flexible fiber optics and the compact probe design allow for versatile and handheld placement and manipulation of the probe, and standard clinical coupling gel is used to achieve acoustical coupling into tissue. So this imaging paradigm is thus very well suited to the conventional clinical workflow. The imaging probe comprises 64 discrete optical fibers corresponding to 64 discrete optical ultrasound sources. These sources are distributed along an imaging aperture in an aperiodic and density tapered pattern, which suppresses grating and side lobes and thereby significantly improves the image quality. The optical fibers themselves are covered by a single ultrasound generating membrane comprising carbon nanotubes and PDMS. The imaging probe was assembled manually using custom laser-cut acrylic substrates, and the probe uses a single fiber optic ultrasound detector placed centrally in the aperture but at an elevational offset to simplify its fabrication. So using excitation light of moderate pulse energy and repetition rate, the generated ultrasound field was measured using a needle hydrophone. A mean pressure across the aperture of 0.24 megapascals was observed at a distance of 1.6 millimeter from the sources, together with a wide bandwidth of 17 megahertz centered around 10 megahertz. Small standard deviations in these measurements confirm a uniform acoustical performance across the source aperture. Images were reconstructed using a basic delay and sum algorithm implemented on a GPU card, and a parallel acquisition and reconstruction scheme allows for real-time and video rate image display using a custom LabVIEW script. Furthermore, a point-like single tungsten wire, which was placed perpendicularly to the imaging plane, was used to determine the imaging resolution of the system. A near isotropic resolution of 173 micron was found. However, these wing-shaped artifacts on the side, visible in the image, which are caused by residual grating lobes, they limit the dynamic range of the imaging system to just 21 decibels. This is mainly limited by the low number of sources, 64 in this case, and the single receiver used, but can be improved upon in future iterations. Despite its limited dynamic range, the optical ultrasound imaging probe still shows great promise for clinical use. First, here we demonstrate its potential use on a tissue mimicking phantom comprising PVA, polyvinyl alcohol, with added glass spheres to achieve physiologically correct acoustical scattering. This phantom contained a wall-less water-filled lumen, seen or indicated here in gray, and a 23 gauge needle was inserted into this lumen along this trajectory. As you can see in the image, the walls of the blood vessel here and here can very clearly be identified, and the needle is as well very highly visible. However, due to the large acoustical contrast between the needle and the phantom, the image artifacts associated with the needle really dominate the image. As you can see when this runs again, as you can see when a needle inserts, you see these enormous artifacts appear. Nevertheless, such an image is still very useful for guiding needle placement. So the flexible nature of the imaging probe allows for freehand probe manipulation, which I demonstrate here by showing the very first in vivo images of my own common carotid artery. Using ultrasound coupling gel, I place the probe against the skin of my neck in the indicated location, indicated by the blue dotted lines, and align the probe such that the imaging plane coincided with the center of the artery lumen. In the resulting real-time image, the pulsatile nature of the blood flow within the artery is clearly recognized, and the image allows as well for the extraction of the artery diameter, in this case roughly 5 millimeters across, as well as my heart rate. So in summary, we presented a novel imaging paradigm using a multitude of optical fibers. A compact and flexible form factor enabled versatile and freehand operation, and rapid scanning optics and parallel computing enabled video rate and real-time image acquisition and display. This resulted in the first demonstration of dynamic imaging of a phantom as well as in vivo tissue. An absence of front-end electronics means that very long cable lengths can be used without the need for special shielding, and in addition, these cables are readily extendable. As the imaging probe comprises only glass and acrylic, the probe is inherently insensitive to electromagnetic interference and hence compatible with MRI imaging, X-ray imaging, as well as ionizing radiation. This will enable simultaneous multimodal imaging and improved image guidance during, for instance, cancer radiotherapy. So thank you very much for your attention, and I look forward to answering any questions you might have.